Without further ado, let's go ahead and kick this off. We will start with the direct service panel. I'd like to introduce Jess here, who will be our moderator for today. And take it away, Jess. Thank you.
Thanks for having me, everyone. I appreciate it. It's a privilege to be here with this powerhouse of behavioral health professionals here in Larimer and Wellington County. So I'm so happy that they invited me. Like I said, my name is Jess. I manage all of SummitStone Health Partners Forensics program. And so anything having to do with the jailer diversion court, I like to be up in there, helping our clients get connected to services after they leave, helping them get connected to services while they're in our correctional facilities, and working with all our community partners with destigmatize substance use and mental health and get people in the right treatment. So what I'm going to do for you all today is help moderate this panel. I'm going to introduce these lovely humans by their name and title, and then I'm going to let them have 6 to 8 minutes to just talk about what they do and how they got where they are today. So we'll let them do that, and then we'll have questions and answers at the end. And I see we have about 22 people on the Zoom, so feel free to throw your chats in there. If you have any questions, we'll try to get to them at the end. And I look forward to learning more about all your career pathways. So we'll just start right over here. We've got Dr. Lesley Brooks. Dr. Lesley Brooks is the Chief of Addiction Medicine at SummitStone Health Partners, which I feel like is a pretty short title because I know she does about 47 more things in a single day. And so we'll give her a chance to introduce herself after I get through the rest of these panelists. We also have Dr. Bradley Crookston, who is the Clinical Administrative Director of North Range Behavioral Health, which is a mouthful, as much as I'm sure his job is full every day. We've got Allyce, did I get that right, Allyce? Excellent. Allyce Torres, who's the Program Director of Crisis Response Co-Responders Squad 1, SESS, UCHealth and North Range, which I hope we get to learn what all of those mean. It sounds like we also have a very full job. And then last but of course not least, we have Silen Wellington. They are the LGBTQ plus outreach coordinator and peer support advocate for the Alliance for Suicide Prevention of Larimer County and the Yarrow Collective Peers of Larimer County. So also an extremely busy human sitting over there, and I can't wait to learn what your day looks like and how you've gotten here. So without further ado, we'll just start over here with Dr. Lesley and let them introduce themselves and tell us how they got where they are today.
Thank you very much for having me here on the panel this morning for this incredible event for these careers that are much needed. So I feel a little like an interloper sometimes in this community. I'm relatively new to the behavioral health community. I am a family physician by training, but I'm also an addiction physician, and I've done because I'm too old to go back to a residency. I did a fellowship in primary care psychiatry. So I feel new to this world of behavioral health. But I believe that not only is healthcare everybody's business, behavioral health is everybody's business. Our tentacles and our impact of our healthcare wellness and behavioral wellness reaches far and wide to every condition. So my pathway, I've been working in safety net medicine, safety net healthcare, public health for the vast majority of my years, of like 20 plus years. And I think probably I think the story that sort of sums it up best is this. I was on my way to law school for a really long time because civil rights was really important in my household. Human rights was really important in my household. My dad was an attorney. He had a complicated background. He was an incredibly bright man, but also had a substance use disorder to be put in. And so that sort of complicated our lives. But first and foremost, he was an attorney who was really dedicated to and interested in human rights and civil rights. So I thought I would follow in his path. And I did the things that you would think that would set someone up for doing that. And then I joined the Peace Corps. And I went and I home sort of going, you know, who cares if you have a First Amendment right to stand in the square and tell the government what you think about them if your children die of diarrheal disease before the age. I then came back and worked for the public health department in Denver, and I had this experience, and this gentleman lives with me in every exam room that I go into and in every encounter that I have. I was doing a study management, so we were enrolling people into a qualitative study on whether or not you could use rapid HIV testing. It wasn't only the foregone conclusion that could be evidence-based, and so we can enroll people out of our sexually transmitted disease clinic at Denver. And we didn't get that many young people. We could enroll down to 18. We didn't get that many young people enrolling in our study, and we didn't get that many young people of color enrolling in our study on HIV counseling, and that's important. And I enrolled one night this young African American gentleman in our study, and I was really feeling myself. I was like, yes, I got I hooked a fish, right? Who agreed to be in our study. And the next morning, before the clinic opened, I got a call from the clinic saying that there's somebody here to see me. And I came downstairs, and there was this gentleman, this African American older gentleman, who had a piece of paper rolled up in his hand. And I introduced myself, sat down, said, "You enrolled my grandson into some study, and I want to make sure that it's safe for him to be in your study." And I wish I knew then what I know now. And I said, of course, it's safe. And I thought I knew. I knew why he was there, right? It's safe. You've got his consent form right there in your hand. It says all of the things that we're not going to deny him treatment. Whether he participates or finishes the study or not, he's good to go. He doesn't have to finish it. He's got all the rights that you see in that consent form. And he said again, "Young lady, I want to make sure that it's safe for him to participate in the study because I remember Tuskegee." And I was like, I knew what he was talking about, right? And we talked about those things in my household. And I think I allayed his fears. His grandson continued in the study. But if I understood these things the way I understand them now, I would have responded differently. I would have said, you have every right to be afraid that we might harm your grandson, that the system of care that we have might harm your grandson disproportionately than we harm other people. And I knew that. I knew then that I wanted to stand in the breach. I wanted to represent both high quality healthcare and be someone who understood the harms that can happen from our systems of care. I wanted to be someone who understood that we as a society, through our policies and procedures, lay the preconditions for disease and despair, and be someone in the exam room who understood those things. So that's me. And from there, I went to medical school, became a family physician, worked for Sunrise Community Health, which is here in Greeley for just under 10 years, and came over to SummitStone about 2 years ago to help lead the implementation and execution of the new behavioral health facility. So I'm delighted to be here this morning. Thank you for having me.
Hard to follow up. The hardest part of today is going to be sitting between two doctors. So my name is Allyce Torres. I'm with North Range Behavioral Health. My story started a little bit differently. I went to college having no idea what I wanted to do, what I wanted to be when I grew up, whatever that means. Started out as a pharmacy major, was 110% positive. I was going to go be a pharmacist, and it was going to be great. Took OChem 2 and was like, yep, nope, not for me. This isn't going to work. Changed my major 6 times. Basically, I just knew I wanted to help people, and I knew I wanted to graduate undergrad and be done. As I was graduating, my advisor pulled me in, and they were like, so you agree to work with CPS, which is DHS here, we will pay for your master's degree. That sounds, okay, let's do it. So I ended up getting my master's degree while working for CPS. While I was working there, I worked there about 3 months before I was the most tenured employee, and they made me a supervisor. That was stressful. While I was doing that, I realized that a lot of the kids that we were removing from homes needed more advocates that were in their corner when they were going to court. So I got really close with CASA, which is the court-appointed special advocates. While I was working with them, they offered me a job, and I was like, okay. So after 3 years of working with CPS, I moved and became a supervisor with CASA, managing 42 advocates that had caseloads of anywhere from 6 to 25 kids. I was going to court with them. I was fighting all these battles to keep them in safe situations. While I was there, I would think I was there maybe a year. I realized foster care needs help. So then I decided that I was going to go be a treatment director at a foster care child placing agency. I ended up managing, I think we had 26 foster homes that we were overseeing. We were doing home studies for new foster agencies, trying to keep kids safe in those foster homes and just trying to manage the behavioral health system, because as we all know, in foster care, a lot of times behaviors then turn into, well, they need placement, they need meds, they need these things. I saw that happening and I was like, I don't think this is right. I think when you remove a kid from a home, a lot of times it's just a new situation that doesn't always need medication. So as I was seeing that happening, I ended up working part-time at a behavioral health hospital in our area. And while I was working there, I worked in the intake department, and I realized that 60% of the kids that were coming in were foster kids, were kids that were removed from their home, and that didn't sit well with me. So with that, I worked both of those jobs for 5 years. After working part-time with the intake department, I had an opportunity to move to be an intake director somewhere further in Texas. And I worked that for about 5 years. Working at intake, I realized there's so much more outside of this where we could be stopping inpatient hospitalizations from ever even happening if we're doing more prevention work, which is how I ended up with North Range. I feel like I found my home. I started out as a crisis program coordinator, working in our crisis center, and came in contact with so many people while we were working there. I really fell in love with our co-responder program, which then led to me applying for the position I'm in now. So I currently oversee our crisis respite facility, which is a up to 14-day program where clients ages 16 and up can kind of get a break from their mental health. It is completely peer run, so we have peers up there that have lived experience that are helping these clients kind of navigate our behavioral health system, whether that be setting up appointments, helping get their IDs, developing coping skills, working through that process. I also oversee our co-responder program, which we are now with 11 police stations in Weld County. Overseeing that has been probably the best part of my job. I get to do a lot of meetings with police, a lot of meetings with dispatch, a lot of just meetings in the community to kind of educate how we can prevent 911 calls from being on the news. Helping clients get the correct care through a clinician, being on scene to help them feel like they're heard and understood when the police are arriving on scene. I also oversee Squad 1. Squad 1 is a cool program with our fire department. It is a three-prong approach where we have a behavioral health person, someone from NCHA, and then a EMS person. So they can kind of do the medical pieces on top of also looking at behavioral health and connecting to resources. I'm trying to think what other programs I have. I have SESS, which is Suicide Education Support Services, and that is basically education in the community to prevent suicide. So they do a lot of QPR training, Safe Teen, which is in the schools, just kind of normalizing talking about their feelings, talking about suicide, and asking those hard questions to make sure that you can get them or your loved ones connected to someone before something bad happens. And I recently gained our UCHealth clinicians. So we have clinicians that are housed in our emergency department. So a lot of times when people are going into emergency departments, they're going for chest pain or things that may not always be medical, and sometimes they just need an assessment to see if maybe this is anxiety, if it's depression, and trying to prevent clients that are going into the emergency department from being placed. We always want to reroute them and see if maybe we can start with a lower level of care like therapy or intensive outpatient or something other than going to a hospital to then be treated for 3 to 7 days and then be back out in the world without any real skills to help better themselves in the future. That's all my programs. I'm gonna give it to Bradley.
All right. So my name is Bradley, and how I got started in behavioral health. So I actually was a biology major my first year of undergrad. I was going to be a chiropractor, and weightlifting, working out, and exercise, and sports and medicine, all that. Chiropractor. So that's what my plan was. I did not do well my first year of undergrad here at UNC actually, and realized that biology was just not my passion. I wanted something more meaningful, purposeful for my career. I didn't know what that was. So I took a break from college, went and moved to Mexico, learned Spanish, and came back from Mexico and just started reading different books for fun, and I realized I was reading a lot of psychology books for fun, reading a lot of Freud, a lot of Rogers. And so I was like, well, maybe I should go back to school and get a psychology. So came back here to UNC and changed my major and psych degree. And throughout my psych program and talking with my advisor, really learned that counseling, clinical counseling, is really where I wanted to go. So I did my master's and my PhD here in UNC as well in counseling and counseling education. So, and part of, I'm sure a lot of you know as students, part of the strain and stress of being able to financial resources to be able to pay for school. So I worked full-time in school, full-time for 11 years. In undergrad, I was doing work as a security guard. It's just the job that I found, and but I knew after I got my bachelor's that I wanted to get a job in the field. I wanted to gain experiences as I was furthering my graduate education. So I got an internship at North Range at the Detox Center, and they hired me on, and I've been there ever since. So going on 10 years now. So with that, I've worked at North Range in a variety of different roles. I was at the Detox Center for all throughout my master's degree, and then after that, I worked as a youth and family clinician, working with gang-related youth and their families in home-based family therapy. After that, I became a director of one of their outpatient clinics, and then recently in the last year, I accepted this job as a clinical administrative director. So North Range is broken up into 4 different networks clinically, and so I supervise one of those 4 networks. And my biggest passion within the field is basically multiculturalism and social justice. I learned a lot firsthand out of the oppressive experiences, especially the Latinx community faces in the United States. And being bilingual, granted I'm fluent in Spanish, but I'm a learned speaker. I'm not a heritage speaker, nor am I a native speaker. So being a learned speaker and working with families who spoke Spanish or bilingual, I learned firsthand the suffering and the oppression they experience in the US. And I remember just across the street over at the Key Hall being observed by my doctoral advisor at the time. She was watching me do family counseling with her mother and son. Mother only spoke Spanish, son spoke English and Spanish, but preferred English. And so I was doing bilingual counseling where the son was speaking primarily English, and I was translating on the fly with his mom, who only spoke Spanish. And I remember coming out of that session where my advisor was watching me behind the glass, and she was like, "You absolutely have to write about this. Probably anyone could have written about this." And so that's what I did my dissertation on. It was bilingual counseling, grounded in multicultural justice. And she was right. The literature was appallingly small on that topic. So, now in my current job, supervising a variety of different programs. Something that I always tell the directors that I supervise is that we are the best network. We never try to find a way. We always say yes, we can help you, and especially to the clients who have been labeled as difficult, challenging, or even unworthy of care, unworthy of services. It's shocking how many times clients have been disregarded or dismissed because of various challenges that they experience, and they're too difficult for treatment. And to me, that's unacceptable. And so we say yes, and we say we can't help you, and we work with them wherever they're at. So, yeah, that's.
Everyone, my name is Silen, as a Silen RT. I use they, them, or he, and pronouns. And I grew up in Fort Collins, and when I was growing up, I was pretty unhappy and pretty suicidal, self-harmed a lot, and something about me didn't feel possible. And I didn't really know why I was experiencing these things. And it took me many years to meet non-binary adults for the first time and start to figure things out about my identity that recontextualized some of what was so difficult for me in my teenage years. I went to CU Boulder studying music composition and psychology. Music is my first and forever love, and I still write music, but I also majored in psychology because I was searching for ways to stay in the world, and also I was searching for ways to support my friends who are also really struggling. And I would often say, like, I would trade my entire degree to know what to say when a friend calls me at 2 a.m. And nowadays I know there's like no right thing to say in that moment, and that it's far more complicated and challenging than that. But pursuing that has allowed me to develop some of those skills to stay in those uncomfortable conversations. After I graduated, I went to Aotearoa, New Zealand, and did the campervan life for a little bit. Spent the first 6 months of the global pandemic on a blissfully COVID-free life raft in the middle of the Pacific Ocean. And when I came back, like, so much of my life had been uprooted. A lot of my plans needed to be put on pause because of the extraordinary circumstances we were all living in. I kind of stumbled into peer support. I was volunteering for Splash LGBTQIA+ youth, facilitating support groups and social spaces for LGBTQ+ teens. One of the other volunteers there worked for the Alliance for Suicide Prevention, and I learned about their work and figured out there was a job opening coming up and applied. And I didn't know about the peer support movement going in, but I started to learn about it through that work. And it was really revelatory for me and made me rethink some of how I experienced my own story. I think I was searching for the peer support movement for like a decade without knowing that it existed. And the peer support as a movement is really about people who have lived experience of mental health struggles, be that psychiatric diagnoses, trauma, experiences of discrimination, getting
getting together amongst that shared lived experience and saying, okay, how are we all staying alive together? How did you make it through these lived experiences? And really using the wisdom of those experiences to find ways to support each other. And part of why peer support is so powerful for me is because it's allowed me to tell my story in the ways that I need to tell it. And what I've come to learn about my story is that there was nothing wrong with the suicidal teenager that I was. There was something wrong with their environment. And it feels serendipitous and purposeful to be getting to do a lot of the advocacy work in the community I grew up in that I really needed when I was a teenager. So nowadays I wear so many different hats, but as LGBTQ+ coordinator of the Alliance for Suicide Prevention, a lot of that work is advocacy and more upstream suicide prevention work. So I go into schools and talk to GSA, Gender and Sexuality Alliance sponsors, talk to those students, see how their club is going, make sure they're getting supported at school. I do a lot of education with counselors and teachers about LGBTQ+ inclusivity, education on like what are pronouns and why are using people's pronouns and respecting their chosen name and pronouns part of suicide prevention. So getting to do that under this banner of suicide prevention feels really exciting and purposeful. And then the other side of my work is peer support. So on any given week, I'm probably facilitating 4 to 5 groups. And a few of those are more general, like LGBTQ+ teen social spaces. Some of them are mental health specific with teens and as well as adults through the Yarrow Collective. We've been facilitating alternatives to suicide peer support groups for adults. And I think what's most nourishing for me about my work is that I feel like I'm being challenged by the right things and getting to learn how to be human with other people. And when I'm sitting in a group with trans teenagers, and one of them starts off group by being like, what do you mean you're never going to call the cops? What if I told you I was going to end my life right after group today? I'm like, okay, like here's where we're starting. Let's get into it. And being able to grow my capacity to sit in that discomfort with that teen and figure out why we're both alive here together feels almost like a spiritual calling. So I'm very glad that I stumbled my way into this world because it's been really healing for me. And it's really exciting for me to be part of this movement of reimagining what mental health support can look like when it's designed by the people with lived experience. So thank you all.
For those introductions, how privileged are we to get to sit here with these lovely humans today and ask them questions? What I'm really gathering as like a middle ground is that all of us sitting up here today have these deeply personal experiences that led us into this field, these deeply personal connections to where we are in our specific field. And that's really what drives the passion of going into social worker counseling or addiction work or marriage and family therapy. And so if anyone in this room or on the Zoom is starting to feel that pull as we tell our stories, maybe give us a call and we can help you get into some peer support roles or some of our, about 200 open positions that we need to fill. So with that, I want to be able to open it up for questions. We'll start here in the room. Feel free to just, raise your hand and shout out questions, and then we can definitely go to the Zoom chat. I see several up there as well. So feel free to direct your questions towards any of us individually or us as a group. Yes.
I have a question. I hear a lot of the theme around where you all landed related to authenticity. Can you speak to any other personality or character traits that really took you to where you are specifically? I think that's helpful for our students and our audience to see if they can resonate with some of that, the personality traits that got you to where you are.
Well, that's a hard one. I'm just thinking what kind of personality traits could have gotten me into this field. But I think the deepest one is just like this inherent inherent need to help people, you know, this inherent want to go out into the world and serve individuals that deserve the care that aren't getting it. And my position allows me to do that with my specific passions, criminal justice, mental health, and substance use, which resonates from experiences when I was growing up. So maybe that'll lay some foundation for the rest of us over here.
Thank you, Jess. That resonates with me. And thank you for the question. I don't know that I've ever pondered this question before. But I would say that the other personality trait, at least for me, is curiosity. I am the feedback that I have gotten over the years is that I ask, you know, all depending on who the purveyor of the feedback is, either too many questions or a lot of questions. But eternally curious about everything, about the oil derricks that I see as I drive up and down Highway 85 in northern Colorado, about the person who might say, well, what do you mean you're not going to phone cops? What if I do X, Y, and Z, right? I mean, to stay curious in those environments, I think is because it's not for everybody. It's not for everybody. There are lots of personality traits that might go, this feels uncomfortable. I'm not sure I want to know more about this. But if you want to know more, if your response to some of these things is to lead in and go, tell me more about that. You might be
That curiosity, I just want to speak. It translates to so many things that I see Dr. Brooks doing on a daily basis. It translates to getting Matt in the Larimer County Jail. It translates to getting coastal care coordinators to get clients out of the jail and connected to ongoing Matt. And it translates to the questions that you can ask the clients when they're sitting in front of you. So,
it translates to a lot of what it does, but doesn't, but systems, right? Why does it work that way? Why can't we do that? What do you mean the answer is no? What do you mean the answer is yes? Why do we do this for this population and not for this population? Right? I think curiosity is an incredible motivator in this field.
And dovetail with that philosophy, so it's like very key is find yourself easy to empathize with others, not sympathize, but you have that compassion and that empathy. And it's to just understand if people are something that you really get and you understand what they're going through. And yeah, I would say that's for sure. I think those that maybe have interested in this field and have decided to go elsewhere, I would see a common theme across the different it's really hard for them to empathize. We're very different from them. And that's a key trait that we deal with as a family. Where the biases and the stereotypes and all of your unconscious thinking and judgment. And that requires a lot of self-awareness along with that. And that is really hard. And I would encourage you to become professional.
I think for me, I've always been an introvert. I've always been the quiet person that sits in the back of the room, doesn't ask questions. I'm not big on public speaking, and knowing like along my journey, I just knew I wanted to be the voice for someone else. I wanted to be able to help support the people like me, who are quieter and who don't do these things. And as I've done this, I've obviously grown a little in being able to do public speaking. But I think just knowing like in the beginning, I never wanted to work with other people. I would be completely fine sitting at a desk, never seeing anyone face to face. And then as I'm seeing these people who are struggling, I wanted to be able to support them. I wanted to see the changes, and I wanted to be beside them as it was happening instead of doing it for them. And I think that changed a lot for me moving forward. So knowing that whatever profession you're going into with these backgrounds in behavioral health, you're gonna be the voice. You're gonna be helping them to make themselves better.
So building up the curiosity and authenticity, I probably add vulnerability. And I don't know if this is necessary for everyone in this field, but like my Mercury's in Scorpio, which means I have like very little patience for small talk. I'm like, don't talk to me about the weather. Like, just tell me what's at the bottom of your soul. Those are the conversations I'm most interested in, and I've of course needed to temper that since like teens take like an approximately like 1.5 years to open up to you, and I've had to learn how to build trust, but. Yeah, the reward from building that trust over time and like getting to hear people's stories and like some of their deepest truths that they might not have shared with other people that they're trusting me with is really rewarding.
The only other thing I can think of to kind of final out this question is that the care that we all have doesn't just extend to our clients, it extends to all of the staff that we serve as well. So moving into a managerial role, I have seen those supervisors and direct service providers and peers that work alongside with me. And for me, my passion is caring for them, preventing burnout, helping deal with vicarious trauma, and making sure that they're okay when they come to work every day. That's part of what keeps me going. That's what keeps me motivated, is seeing all these amazing humans who care and keeping them well to the best of my ability. All right, we have more questions in the room. Well, you all can think about it. We have plenty of these chats on Zoom. If you want to help me with, if you have a question, go ahead, and then maybe we can get the chat questions ready as well.
Actually, Jess, I was just going to ask, would you like me to ask the online questions that aloud? What would be best?
That'd be great.
Yeah, you bet. Well, first of all, thank you all for sharing and thank you for being here. What incredible stories to share. Really appreciate it. So this question from the audience is specifically for Dr. Brooks. But as a forensic manager who works in correctional facilities, this attendee wanted to know, is there somewhere in the forensic psychology field that offers internships or any type of experiential education?
I really appreciate that question. I'm gonna phone a friend. I'm gonna ask Jess.
Thank you. Thank you, Dr. Brooks. I appreciate it. Dr. Brooks has done a lot of things in the jail, but I have the privilege of getting to go in, and they also let me out when I want to leave. So I'm very happy about that. And also gives me a lot of empathy for the individuals who are incarcerated, likely because of mental health or substance use concerns. And so as far as career opportunities in forensics, you can absolutely get a degree specifically in forensic psychology. You can get a master's degree and PhD. I personally have a LPC and a license in addiction, and I just accidentally fell into this job. When I started working at the Coalition for the Homeless, I realized there were all these people experiencing homelessness that were getting reincarcerated over and over. And so we started a program called the Social Impact Fund, where the city of Denver found private philanthropers and gave us $8.7 million with the mental health center at Denver and said, hey, I'm going to give you a name and a birthday. Go find these humans and put them in a house and see what happens. And what happened was that they did really well, is that the clients did really well. And the city of Denver kept throwing money at us. But to get back to your question, which I realized I veered off from in my storytelling, is that yes, we have internships. Come over, give me a call. I can, if you want to work in like the Larimer County Jail or the Wellington County Jail, we have partnerships with the Office of Behavioral Health that fund us to work in these facilities. Fair warning, you do have to pass an extensive background check to be able to go in and out of the Larimer County Jail. So give me a call and I'll talk to you more about that. But we have internship opportunities where you're not necessarily in the jail every day, but you're working with this forensic population. You're working to get people connected as they leave, and trying to prevent them from falling in what I call the black hole, which is the parking lot of the jail where we can't ever find anyone again. So, thank you. Go back to our chat here.
The next question from the virtual audience, and this may be for you, Jess, although I think it's probably anyone who may have an LPC. But has your LPC license helped you in your job and to better understand psychology in your patients?
Excellent. Well, I know we have an LCSW here as well, so I'll let them speak to that, but, you know, the LCSW, marriage and family, if you're really into couples, marriage and family, go down that road, but any of these degrees really will allow you to do kind of work in all the areas. So if you're looking at a social work, you're gonna be looking at like a macro level. You're gonna be looking at working with systems, but you can also do direct therapy. You're just not likely gonna have as many classes where you're doing direct therapy with individuals. You'll have enough to where you're competent and confident to do that. The LPC really dives into multiculturalism, dives into what you were speaking of sitting down with individuals and having really hard conversations and developing that empathy. And really, to be frank, the LCSW allows you to be able to do a lot more when you talk about supervising different professions and when you talk about serving like a Medicare client, because the LCSWs have a lot of great lobbyists and the LPC, they're just like, I'm gonna do some therapy. And then the LAC allows us to serve people with addictions. And so they've changed a lot of those rules recently. I know that CSU is a master of addiction counseling, where you can actually walk out with a license, which is unheard of. And so really, if you want to see clients in any capacity, any of those will work. The LCSW tends to be one of the easier ways in, unless you really want to learn those marriage and family skills, addiction skills, or counseling skills. Do you have any more thoughts about the situation we're in?
Yeah, I can add to that. So I'm an LPC as well, and I would say you absolutely, if you're going to come into this field, you absolutely want to be eligible for licensure. So that's as an LCSW, an LRT, an LPC, or an LP. If you're wanting to do therapy and counseling with clients, then you need to be licensed. And license eligibility ensures that the education that you receive is comprehensive and not so that you are competent. You can cause harm working with individuals. Unknowingly, unintentionally, you can cause harm. And so what a license does is it keeps the head against that. And it's all about protecting the public. That's why the licensures are in place. That's why we have the NSW and KCRAP accrediting various programs. It's a very somber and serious duty to go and serve the public. Not everybody can do this, and you want to make sure that you're not doing more harm than you would. We work with some very vulnerable populations. And put their trust in us, and we have to be willing with that. Unfortunately, throughout history, the field does not have the greatest track record of protecting the public, especially prior to and even since then. We have a case in Colorado where children died because an unlicensed counselor, psychotherapist, was doing reversion techniques. That's why it's illegal in Colorado to do sort of reversion techniques, because children die, come back. So licensure is absolutely essential. Can't stress it.
I want to also caveat and make sure we talk about the peer specialists or peer navigators that we have, because at SummitStone specifically, and I'm sure at North Range as well, we realized that going to get degrees and licensures takes a certain level of privilege. It really does. And not everyone has that capacity. I remember when I was applying to grad schools coming from a severe poverty situation in a town called Oak Grove, Missouri, and all of a sudden I had to come up with $2,000 to take tests and apply to schools. I didn't have that money. I had to take a loan out to do that. And then I had to take a massive loan out that I'm going to pay for the rest of my life. So, get some scholarships is what I'm saying. But not everyone has that privilege, and I recognize that. And so we really also value the lived experience of individuals, the lived experience of people who have been through what others are going through. And so recognizing that there are peer specialist certifications and training, there are peer navigator certifications and training to make sure that we keep the public safe, but still place value on that lived experience, like we have with Bradley. Great questions, team. Keep them coming.
I have a question.
Yeah.
Just wondering what you think the most valuable, undergraduate class that any of these took that prepares you for graduate for like what you're doing now.
Well, I Psych 101 at Front Range. So, you know, let's come take Psych 101 with me. We'll have a great time. But, go ahead, Steve.
So I think for me, it would be just sociology, the sociology class where I was learning like about humans and just how to interact with people. I think that's where I realized like this is what I want to do. But I didn't know how to make that a career. Just being in the classes, like there's no way you can just work and be a sociologist and do all these things. So I think that opened the door for me to then look further into like what other classes are like this. Where can I learn about behaviors in humans and how they interact with others?
All right, next question.
I think I can
Oh,
answer
yes,
that.
please.
I mean,
Absolutely.
I don't know how relevant it'll be for others, but like really any class I took in my LGBTQ plus certificate and queer studies was definitely super important to the work that I'm doing now. And I like a lot of the framework of the queer theory that I learned like helped me contextualize my own experience in like a more sociological sense that I think is really necessary when you're working with individuals to not forget that they're like in these larger social systems that are affecting how they experience their own brains, their own bodies, etc.
Thank you for that. Good questions. Go back to the chat. I think I have no idea what time it is actually.
We have about 7-8 minutes.
7-8 minutes of chat questions.
And this next question, I believe, is for Silen. And the attendee asks, I live in Colorado Springs and was curious if there were any partnerships with places closer to Southern Colorado, particularly involving the LGBTQ communities, that work with interns at an undergraduate level. And of course, open to anyone, but Silen, it seems like you may want to say.
Off the top of my head, the main LGBTQ plus organization in Colorado Springs is Inside Out Services. I'm not sure. I think there's also like an adult LGBTQ plus adult surveying board in Colorado Springs, but I need to do some more research. I'm not sure if they take interns or not, but if you want to drop my email in the chat, I think we have some more organizations for you since I do. Yeah, they're in my brain and sometimes they're on paper and I might be forgetting some. My email is silen@suicideprevent.org.
Yeah, and anyone here or on the Zoom that's interested in talking with us further, I believe that our coordinators with this have our emails. Feel free to reach out to me or for us anytime if you're interested in this field, interested in internships. We'd love to talk to you more. I have so many more things to say about forensics, but I'll keep it short, today. All right, any more chat questions we want to?
There is one more chat question. I appreciate that you're validating lived experience in this work. Could you speak more to what a career path might look like for someone who can't access advanced education right now, but is interested in moving into this space? Any specific suggestions?
Well, I think Silen has probably the most lived experience and is applying it. And then I also think that Dr. Brooks probably has some ideas with the coleslaw. And then I bet North Branch is doing some amazing things with the peers. So tell me everything. I'm interested too.
Yes, I think there are lots, the answer is yes. I think there are lots of career pathways that don't require all these initials after the name. To be fair, I think that the struggle between, accountability and making sure that, people are safe to work with the public, et cetera, has sort of made us clunky in that regard and sort of forced, has compelled us to sort of rely on, you need, this, that, and the other thing to be qualified for these positions. But there are more and more opportunities for folks who don't necessarily have access to the degrees that we're talking about today. So case managers and we can train you on the job. It used to be that medical assistants could be trained on the job, and some of that still exists. That's a more medicalized role. But yes, there and peers as well, that can undergo on the job training. Yeah, I would definitely recommend looking into some mental health related nonprofits and just seeing what those positions are, because the Alliance for Suicide Prevention, at any given time, probably half of our staff, like our masters and MSWs, like we hire a lot of people right out of undergraduate to do like youth facilitation training. So some of my coworkers go into schools and just give presentations about mental health, kind of in that education advocacy realm of things. And I would also, I'm not sure who's the like top employer of peers in the state, but Rocky Mountain Crisis Partners, who runs the Colorado Crisis Line, they have a peer line, for instance, and I'm not sure what qualifications are in their job descriptions, but they hire a lot of peers to like respond to those crisis calls. So I think there are ways that, and SummitStone too, so others on the panel can probably speak more to that, like have peer teams where they hire people and train them like as part of the job. I don't have my peer certification licensure right now, but like I'm pursuing it like as part of my work right now, and like getting that mentorship, getting those spaces of co-reflection or clinical supervision as part of my job to make sure that we're upholding and not doing harm, upholding those standards that we need to. So that was a long ramble. I hope some of it was useful.
Then I can say a shameless plug for North Range. So we have multiple positions open where you can be hired and work as a peer. If you do have your undergraduate degree, we have case manager positions. We have case managers who are also practicing as clinicians under the supervision of licensed master's level folks. But we also have a new program where if you're working at North Range, we will offer to help pay for your master's degree in return with you working with us. So being able to also have that opportunity where we can help you pursue an advanced degree while working with us and hopefully staying with us after you get your master's is also an option that we have at North Range.
And then, also for those who are interested in the addiction field, there are a lot of levels of areas of addiction you can get certifications. And there's a certified addiction technician that is able to do some technician type services with clients. If you have the bachelor's degree or enough related experience, you're allowed to have a certified addiction specialist, which offers on-the-job training and classes and supervision to provide addiction services to individuals.
Yeah, absolutely. There's a lot of opportunities you can pursue in this field if you have a bachelor's degree, if you don't have a bachelor's. Typically, when it comes to counseling therapy, it's the master's degree required. But to add to what Allyce was saying at North Range, we actually just created a new bachelor level position across the agency. And so, core competency training for bachelor level folks. So those that don't have the opportunity or like we talked earlier about the privilege associated with being able to pursue a master's degree. If you're not able to do that, then you have a bachelor's degree, come on, you're training through North Range, and then you have on-site supervision through some of the Liz license, and you actually are functioning as a clinician with a bachelor's degree.
Well, I just want to say a huge thank you to everyone who showed up today and asked questions. A huge shout out to our panelists for sharing their time and expertise with us. I'm just a privilege to be with all of you today. So thank you very much.
Thank you.
If you need a job. Shameless plug.
We
We're
also
all
have a
hiring.
full
We're all
breakout
hiring.
session about that, guys, at 12:30. So if you're interested.
Thanks, everyone. That was super fun.